According to Tuthelian and Gedeke 1993, management is a process which brings together resources and unite them in such a way that collectively they achieve goals or objectives in the most efficient manner possible. This means management is a process which is simply a method of doing something. Processes are used to perform simple everyday tasks as well as more complex activities.
There are 5 functions of management by BSPHA: planning, staffing, organizing, directing or leading, and controlling or evaluation. Planning entails predetermining a course of action based on one's goals and objectives. Managers must consider many factors when planning, including their internal and external environment. The director of a hospital pharmacy will develop plans to predetermine which drug products he wishes to carry or what professional services he or she might offer.
Staffing. Staffing is an important managerial function where this involves manning the organization structure through proper and effective selection, appraisal, and development of the personnels to fill the roles assigned to the employers. This also pertains to recruitment, selection, development, and compensation of subordinates.
Organizing is the arrangement and relationship of activities and resources necessary for the effective accomplishment of a goal or objective. Once a pharmacist has decided which drug products or services she should offer, she needs to ask herself, what are the resources needed and able to provide them, and how will she obtain these resources? And lastly, she needs to determine when she will need to obtain them.
Directing or leading. Pharmacists eventually may offer the goods and services described in her plans, but almost certainly she will need to work with a number of other people within her organization to accomplish this task. It also involves bringing about purposeful action towards some desired outcome.
Controlling or evaluation in functions of management involves reviewing the progress that has been made toward the objectives and were set out in the plan. Performing quality control checks to help ensure that patients are receiving the desired medication in an appropriate manner is a very important function of a pharmacy practice. Pharmacists can also ask themselves if goods and services they offered met their goals. These goals can be from the perspective of their patients as well as from other perspectives. Controlling determines that is being accomplished, that is, evaluating the performance, and if necessary, taking corrective measures so that the performance takes place according to plans.
Management skills and roles. Application in hospital pharmacy practice.
Every hospital pharmacist is a manager.
Every pharmacist must acquire, maintain, and constantly update a unique and specialized body of knowledge.
Every pharmacist must learn to direct, support, persuade, discipline, and collaborate with others.
Every pharmacist is expected to understand and use the principles of accounting, finance, economics, marketing, and informatics. Indeed, optimal patient care depends on a pharmacist's ability to thoughtfully apply the science of therapeutics and on his or her ability to manage people and information.
Pharmacists with excellent management skills and average clinical knowledge is more effective than a pharmacist with a poor management skills and excellent knowledge.
The SAR rules, the reporting structure, and formal lines of communication within the institution. The Board of Trustees. There are 3 Chief Executive Officers, which is Financial Officer, Chief Operating Officer, and Chief Medical Officer. There are 5 Vice Presidents under the Chief Operating Officer, which includes the Vice President of Human Resources, Ambulatory Care, Inpatient Services, Clinical Support, and General Services. This shows the hospital organizational chart of the Department of Pharmacy. The Pharmacy Department under the Vice President for Clinical Support. It is important to realize that the position of the Pharmacy Department and the Administrator, to whom the Director of Pharmacy reform can significantly affect how senior manager and others view the pharmacy. The pharmacy practice president is the director of pharmacy and the department of sanitary. It has a full director of pharmacy, assistant director for clinical services, and for the assistant director.
According to the Book of American Society of Health System Pharmacists, 2006, page 297, the American Society for Health System Pharmacists, or ASHP, has developed a list of practice standards that define acceptable professional practices. The 6 basic standards are:
the pharmacy shall be managed by professional, competent, legally qualified pharmacists. The director of pharmacy must be thoroughly knowledgeable about hospital practice and
The pharmacy shall provide patient-specific drug information and accurate and comprehensive information about drugs to other pharmacists, health professional, and patient as appropriate.
The pharmacist, in concert with the medical and nursing staffs, must develop policies and procedures for ensuring the quality of medication therapy. This must include process designed to ensure the safe and effective use of medications and to increase the probability of desired patient outcomes.
The pharmacy shall be responsible for the procurement, distribution, and control of all drug products used in the hospital.
To ensure optimal operational performance and quality patient care, adequate space, equipment, and supplies shall be available for all professionals and administrative functions relating to medication
The
use.
pharmacist should initiate, participate in, and support medical and pharmaceutical research appropriate to goals, objectives, and resources of the specific hospital.
State boards of pharmacy and departments of public health also influence hospital pharmacy practice. State boards serve as licensing bodies for both the location of pharmacies and those individuals able to practice. Department of Public Health, or DPH, uphold the public interest in quality pharmacy service within the laws and regulations of the state. Joint Commission, an independent not-for-profit organization governed by a board that includes physicians, nurses, and consumers, sets the standards by which healthcare quality is measured. The hospital organization, external regulatory bodies, and standards of pharmacy practice define the formal structure within which a pharmacy manager must operate. The skilled manager also recognizes the informal relationships within the hospital and works to develop a good rapport with influential clinicians, key hospital administrators, and physician leadership. Pharmacy managers who display a genuine concern for patients and can work effectively with the hospital's professional staffs will achieve the pharmacy's mission more easily. The development of such relationships should be a priority for every pharmacist.
Hospitals 2 kinds of committees. Standing committees. Permanent and cannot be dissolved without changing the bylaws. Usually have ongoing business to conduct throughout the year and therefore must meet regularly. Examples include the hospital's committee on credentialing and the pharmacy and therapeutics committee. Special or ad hoc committees. Chartered as needed to solve special problems and then are dissolved when the task is completed.
Most medical staff bylaws call for pharmacy and therapeutics or PMT committee consisting of physicians, nurses, pharmacists, and administrator. There are 2 primary purposes of the PMT committee. First is policy development. The committee formulates policies regarding evaluation, selection, and therapeutic use of drugs and related devices. Second is education. The committee recommends or assists in the formulation of programs designed to meet the needs of the professional staff such as physicians, nurses, pharmacists, and other health practitioners for complete current knowledge on matters related to drugs and drug use.
2 models that can describe traditional approaches to the management of clinical pharmacy services in a hospital. First is the generalist model. Maintains that for the pharmacist to affect the care of the patients, it is necessary to be present where and when the drug therapy decisions are made. Pharmacists are responsible for both clinical and drug distribution services. Some of the pharmacist's activities must be supported using qualified pharmacy technician. Second, a specialist model, which a distinction is made between clinical pharmacists and staff pharmacists, responsible for providing clinical pharmacy services throughout the hospital. Sometimes, a full-time college of pharmacy faculty members serves as a specialized clinicians. The generalist and the specialist models have been successful in many hospitals if there has been a systematic approach to development, implementation, and the evaluation of the clinical services provided. The primary focus of a clinical service should be the patient and not a medical service or a drug category.
The role of any hospital pharmacy manager is complicated by his or her broad span of responsibility. These middle managers accomplish their goals by cultivating relationships in multiple dimensions. They relate to superiors as a subordinate. They take orders. They relate to their team as a superior. They direct. And they relate to peers in their organization as their equal. They cooperate.
Effective hospital pharmacy managers are, above all, good leaders. Hospitals should be organized to maximize learning. Organizations should exhibit a loose coherence. Employees must be held to the overall goals and mission of the organization while they can experiment and to try novel approaches to solving problems.
Pharmacy managers should consider the mission of the department to determine the composition of workforce needed. This human resource plan usually allows for, first, identification of the right number of people with the proper skills that will be needed. Second, acquiring or training and developing the people who will be needed. And lastly, motivating them to achieve their highest level of performance and become long-term employees.